Hi, my name is Bianca Allardyce, and today I'll be talking to you about the link between HIV and tuberculosis and why it is most prevalent in developing countries. To start off, HIV, or human immunodeficiency virus, is a virus which attacks the immune system. It prevents our bodies from being able to combat against illness. The virus uses T helper cells, a type of white blood cell, to produce copies of itself. The diagram shows some of the ways you can get infected with HIV. However, there are also many misconceptions about how you can get infected, such as you can't be infected by a surface someone with HIV has had contact with, or through breathing the same air as them. Tuberculosis, or TB, is an infectious bacterial disease that can be identified by the growth of nodules in body tissue, specifically that of the lungs. On this slide, I've provided a table containing the symptoms that can be present in TB and HIV. You'll see many of them overlap, specifically the overall symptoms such as fever, loss of appetite, and night sweats. Regarding these two diseases, there are several factors which affect the treatment of them when presented together. These include: does the individual present with symptoms of either infection? Treatment would be handled differently should an individual only present with the symptoms of one or the other or even both infections. Is the individual already being treated for either HIV or TB? This will be further discussed on the next slide. Depending on where the person is, the availability of treatment will need to be considered. This point contributes to the overall question of why is it most prevalent in developing countries. And certainly, if someone presents with these illnesses in a place like Melbourne, they will certainly get the correct treatment and be well taken care of. However, they're not likely to be followed up on in a place like Johannesburg, where there are many patients and probably not the correct resources to follow up on patients. Following on from the factors affecting the treatment of these diseases themselves provide another factor to take into consideration. When both are present, they can exacerbate or agitate the other disease's symptoms. However, the treatment of both infections is necessary because if not treated, they can both worsen and likely decrease the individual's lifespan further. The individual treatment of HIV could lead to the immune response immune reconstruction inflammatory syndrome, or IRIS, which is a condition when the immune system begins to recover from the initial infection such as HIV or AIDS or immunosuppression. However, it then responds to an infection previously acquired that leads to a relapse, which paradoxically makes the symptoms of infection worse. I would say that a positive of this response is that the individual could be unaware that they're infected by both of these diseases, and the IRIS response then leads the individual to the correct treatment. So why is this only prevalent in developing countries? They are more common in developing countries due to multiple factors, including a lack of education surrounding the infection, an absence of access to public health services, impoverished and/or crowded living conditions, poor nutrition, and corruption. Having grown up in South Africa, I have found that all of these factors certainly play a part in the slow progression of fighting the HIV/AIDS epidemic present. On this slide, I've provided an example of how a lack of education and politics plays a part in a country such as South Africa's understanding of health-related issues. In 2006, the current president, Jacob Zuma, during a court case in which he was being charged for raping an HIV-positive woman, stated that he had had a shower in order to ward off the risk of HIV after he had had unprotected sex with her. This statement was believed by some uneducated individuals, and so proving that education is key. So what's being done to improve the situation? The World Health Organization is working on 6 main areas to combat against these infections. These include the following: promoting the collaboration of TB and HIV services at all levels, universal antiretroviral therapy for all HIV-infected TB patients, scaling up the 3 I's for TB and HIV, improving data for TB and HIV, antiretroviral therapy for prevention, partnering with civil society to scale up TB and HIV activities. If you'd like to read up more about these specific areas they're working on, you can visit their website with the link. So specifically within problem areas such as South Africa, there are councils set out by their governments to combat the issue. The South African National AIDS Council, or SANAC, have launched the first ever LGBTI HIV plan, not only for South Africa but for the world, at a satellite session during this year's SA AIDS conference. This plan will run concurrently with the newly launched National Statistic Plan for HIV, TB, and STIs for the period of 2017 to 2022. On this slide, I've provided a link to the South African National AIDS Council's website if you'd like to see what else they're doing. Here are some of the resources I've used, and thank you for listening.